so-called deceased that bear the brunt of this whole tragedy?
Okay, thanks. Let's look at both demand and supply, like I said earlier. The populace that is procuring health service has to be an educated populace. So the general education is key. Let me tell you, I'll give you an example. Most of these quants, do you know what they do? They will go into the hinterland where they know that people cannot decipher what they are selling to them. They actually ride on the ignorance of the people to push fake drugs to them. So that tells you that if the people are educated, I'm even talking of basic education, they stand a better chance. And then if you then layer on that education in languages people can recognize, that's even an improvement. That's the supply side. That's the demand side of the populace. The supply side, production. What NAFDAC is doing, the great work NAFDAC is doing, has to be strengthened. Can they monitor all the points across the country where that are notorious for producing fake drugs? Can they monitor supply chains of authenticated drugs so that the supply chain is not broken for people to feed in their fake drugs into the normal health system? That is done also. You will find people who are pushing fake drugs. They hang around health system hubs. They know a teaching hospital is somewhere. They will hang around that so that they can also channel their fakes into that supply chain. That also requires a whole lot of regulation. Law enforcement is key. You rarely get to see some of the. I mean, people selling fake drugs. Sorry, I'm laughing.
No, it's fine.
I've been in a major general hospital, and I took a picture of an agbo seller right in the general hospital.
General hospital.
Walking. I'm telling you, I took a picture. Right in the general hospital, spelling herbal drugs. Of course, we are not saying herbal drugs are essentially fake. We are just saying how will you even allow something that is not regulated to be displayed within a general hospital. So regulation, enforcement, inspection. So if you have every ministry has a department devoted to this, but is that department resourced to be able to go on inspection, to be able to go and verify whether a health facility has renewed its license? So all these are what the government has to put in place to ensure that we minimize medical errors. Like I said earlier, we don't have cases where you have completely, totally eliminated medical error, but it can be massively minimized.
Thank you very much, Dr. Phillips.